Hi. Today I want to talk about lap bands and lap band slips. Most people that have a lap band are going to do pretty well. They're going to get their weight off, they'll keep it off forever. The lap band can stay in your body forever. It's not biodegradable, it's plastic, it's not going to change. As long as it doesn't slip or cause other problems, you're fine. You just leave it there, you don't have to do anything about it. Once you have problems, you need to be evaluated. And also, I strongly recommend that anybody that has a lap band get evaluated at least once every other year to identify if they have problems that they don't realize. What are the problems that I'm talking about? Well, the main one is a lap band slip. The lap band is very specific. It has to be around the stomach in a very precise position. Now, if that lap band is around the stomach lower down, that's called a lap band slip. Incidentally, if the lap band slips up, it ends up around your esophagus and it doesn't work at all. So either way, whether the lap band is moved lower around your stomach or if it's moved upper and it's around your esophagus, it's a problem. What kind of symptoms would you have in these situations? I happen to have put in hundreds and hundreds of lap bands and had hundreds of lap bands put in my bariatric surgery program in the past. In fact, my father had a lap band and it worked very well for him. But there are some complications. And if the lap band moves up and it's around your esophagus, you might not feel anything. The lap band might just stop working because it's around your esophagus and it's not compressing anything. Your esophagus is narrower than your stomach. And so if your lap band is now around your esophagus, it's not going to be squeezing the esophagus most likely. But if it is around the esophagus, oftentimes it's at a bit of an angle, and that results in compression of the esophagus and squeezing of the esophagus, which results in you feeling like you're choking. What people usually do is they feel like food's getting stuck up here, but it's not. It's down here. It's the sensation is that it's up here, even though it's not. And so people start to feel that if the band is around the upper part of your esophagus. The other thing that can cause that sensation is if you develop a hiatal hernia, which you can develop, and people develop them. It's not that you've done anything wrong necessarily. Most people that develop hiatal hernias, it's just, luck of the draw. It's kind of like some people develop groin hernias. It doesn't necessarily mean they lifted too much weight. It's luck of the draw. So if you have a band that slips up around the esophagus or you develop a hiatal hernia, you can get the feeling of choking or food getting stuck, and usually it feels like it's getting stuck right up here. If the band slips downward, what that does is it leaves more of your stomach above the band. When you have more of your stomach above the band, you can actually eat more food before you have to stop. Problem is that the food will still go through that banded area of the stomach, the narrow area, slowly. So while it's sitting in that upper stomach, because you can get more in there, it's going to sit there for longer. People then get bad breath, they get more burping, they get reflux. These are the symptoms they get because there's more stomach above the band, okay? You can actually reposition the band and move it back up. That probably is effective about, I'd say 50% of the time. About 50% of the time, if you do that, the band will slip again within the first year back to where it was, and you'll have the problem all over again. But if you're careful and you reposition it, some of the time it'll work just fine. Okay. But if you have the band slip down and you start to get these symptoms, that's something that needs to be evaluated, and it can be evaluated fairly easily. The problem with the band slipping, particularly slipping down, is that you have to picture your stomach as a big bag, and it's got a blood supply that keeps it alive. The blood supply comes into the stomach lower down, okay? And if the band slips down, it slips down around a wider portion of the stomach, and so it's actually squeezing the stomach harder because the band doesn't change shape. It's plastic and it's fixed in shape. And when it slips down around the stomach, it's going to be squeezing harder on the stomach than it did where it was positioned by the surgeon who put it in. When this happens, the big risk is that it can compromise the blood supply to your upper stomach. Okay. The blood supply to your upper stomach primarily comes from further down in the stomach. And if you're squeezing too hard on the stomach, the band can cut off the blood supply. I've seen this about a half a dozen times. Every single time it's caused sudden pain in the person. Some of the time, one of the times the patient was up in Oregon, was getting intermittent pain due to intermittently cutting off the blood supply to their stomach. They had the patient in the hospital and they were telling the patient, it's all in your head. There's nothing really wrong. We've checked it out. It's fine. The patient called me. I actually called up there and spoke to the surgeon at the hospital that the patient was at and said, look, this is a problem. You've got to get them to a hospital where they do bariatric surgery and you have to fix this. And they refused. So the patient signed out of the hospital against medical advice, got on a flight, flew straight down here, took the patient to surgery, and the stomach, by the time we got the patient to surgery, the stomach was starting to turn blue. Got the patient's band off of the stomach, the blood supply opened up again, and the stomach was healthy within a day. But it was really touch and go, and it was dangerous. And when this happens, it happens suddenly. So it's something to be concerned about for sure. It's very rare, but if it happens suddenly. And if you have a band slip that's significant, you're predisposed to this happening and you're at risk for this. And that's something that should be fixed. So the symptoms of the band slipping up are generally feeling like you might feel like you can eat more easily because the band isn't squeezing your stomach. More likely you feel like food gets stuck here in your throat, and it's really just getting stuck down here where the band is around the esophagus. If the band slips downward, you have too much stomach above the band, you'll be able to eat too much. The food will stay there longer. It'll be digested way up in your stomach, which isn't normal, which means you'll develop bad breath, you'll develop burping, you'll develop reflux, and that's a warning sign that the band has slipped down. And by the time you get pain from the band slipping down, you really need surgery as soon as possible. If you just have the other symptoms, you should go in and get evaluated and see whether there's something wrong. Okay, this is for about band slips. And I've got hundreds of patients out there. I'm sure most of them are doing fine. But if any of you have problems like this or know of anybody who's having problems like this, send them on in. We'll evaluate them and fix the problem if there is one. All right. I hope this helps. Have a great day.